Common orthopedic injuries.
The most common orthopedic injuries are due to strain and stress that causes the ankle sprains. Then there is a possibility of knee joint pains, knee joint injuries, ligaments injuries, and then sometimes elbow injuries and the wrist injuries, and then sometimes vertebral body injuries. These are the injuries where due to certain sports activities or irregular gaming activities or sometimes unknowingly the stepping up and stepping down also causes certain injuries, and then vehicular or RTR, road traffic accidents. Apart from this, in the old age, usually because of the weakness, they fall from the chairs and the bed, and usually causes the major fractures in the wrist, in the elbow, or in the back, vertebral body fractures, or else in hip or knee. So whatever the injuries are there, we need to diagnose it properly with the CT scan, X-ray and MRI, whatever required, wherever required. And once the diagnosis is confirmed with the injuries, then we should treat whether conservatively or surgically. So obviously, when we do a conservative treatment, when as far as possible the anatomical position in the injury is well maintained, then it doesn't require as such any surgical treatment unless until for early mobility and professional usability. So in the fractures, for example, you take in vertebral column, when there is a vertebral body wedge compression is there, but there is no neurological injury, then no need to do surgery. You can give a talus brace and back rest for 6 weeks, and then medication, so that the without neurological deficit the person will recover properly. And certain fractures in the lower limbs, upper limbs as such are undisplaced with anatomical good anatomical position, then we no need to do a surgery, where we can put a splint or the cast in an anatomical position so that it heals naturally, and with the medicines we can control the swelling, pain and inflammation. So these are the ways we do surgery. We don't do the surgeries, we do with the splinting or with the POP cast after good reduction, and then we manage it. But certain fractures which are really troublesome, like are unnecessarily, the person has to lie down on the bed for 3 to 4 months with the fracture healing slowly, and that will hamper his professional work and as well as the daily activities. So such people, active people, we can do certain simple procedures with the uh, proper stabilized nail with the screws or any other implant. We can use it so that the person can be mobilized 2 to 3 weeks. So if not, then major fractures, like major fractures in the knee joint, hip joint or elbow joint or in the wrist joint or anywhere wherever the joint has internal fracture, then those fractures need to be fixed with the properly plated screws or whatever implant you use, and then stabilize properly so that the joint congruity will be well maintained, and the joint shouldn't trouble in the future. So otherwise, if you not properly fix it, the intra-articular joint fractures, then the problems for while walking or problems for future may develop because of the improper union of the base of the joints. So these joint fractures are to be taken care properly. You should make them sit anatomically and fix it properly with a good stabilization, so that even if you move early within 3 weeks or 4 weeks or after 6 weeks, you will have a proper knee, proper joint without stiffness, and then you will early mobilize. You can early mobilize the joints as well. You can walk and you can go for his profession. So such way we need to use the fractures to be fixed according to the displacement as well as the position of the intra-articular fractures or certain other causes where we need to do a surgery. So surgical indication is according to the protocols as well as the patient's psychological and the professional duties. So as such, we need to fix wherever necessary. Thank you.